Hello, Dr. Kenzig and fellow classmates. Hello, Dr. Kenzig and fellow classmates. Thank you for taking the time to attend our presentation today. We're excited to share our project, Meals in Motion Evaluation Mini Food Pantry Drive-thru Model. My name is Marcia, and I'm joined by my teammates, Marie and Sama. Together, we evaluated one of Minnie's food pantry's core services to better understand how it operates and how it contributes to food security in the community. Our objectives are as follows. Next slide, please. Our objectives are as follows. We'll give a brief description of the program. We'll share the components that we used for the evaluation question, how we approach to answering the question, the structure and design of the evaluation, our proposed data for collection, the data collection method, data presentation to stakeholders, and at the end, we'll give the brief review and key takeaways. Next slide, please. This program was originally launched during the COVID-19 pandemic as a response to growing food insecurity during the pandemic and following mandates that required social distancing. It's now become a long-term part of the hunger relief strategy. This service runs from Wednesday through Saturday and provides pre-packaged food boxes directly to clients' vehicles. The setup helps reduce barriers like limited transportation and also helps reduce the stigma that can come with standing in a line at a traditional food pantry. In Collin County, more than 130 people are food insecure, and many of them aren't eligible for food nutrition assistance program. Minnie is helping closing that gap by serving over 5,000 individuals a month. The food boxes contain self-staple items, fresh produce, culturally appropriate options. Staff and volunteer help guide cars, verify eligibility, load the food boxes. By creating a safe, efficient, and dignified experience, Even now, after the height of the pandemic, challenges like inflation and job instability continue to affect the vulnerable households. That's why this service is still so important. Its goals are to reduce hunger in the short term, improve access to healthy food, support client dignity, especially in underserved communities. Our evaluation is looking at whether the drive-thru is effectively reaching the people who need it the most, providing consistent service, and actually improving food access and nutrition. What we learn will strengthen the program and guide future decisions. Next slide, please.
Program focus and evaluation. Our evaluation of Minnie's Food Pantry focuses on assessing the effectiveness of the drive-thru service and determining whether it is achieving its goal, specifically in reducing food insecurity. This evaluation also promotes continuous quality improvement. Minnie's drive-thru program offers a community-driven solution to hunger by providing accessible and nutritious food to low-income households in Plano, Texas. The program aims to encourage healthier food choices and reduce the stigma associated with food assistance. It addresses the immediate need for food while also working towards long-term goals of reducing food insecurity and promoting healthy eating within the community. Our group has chosen to evaluate 3 different logic model components: activity, sorting food by type; output, number of food boxes distributed weekly; long-term outcome, reduce food insecurity in Plano, Texas. Those choices will be highlighted in the logic model on the next slide. So the logic model has situations, which is key facts that highlighted high rates of food insecurity, social stigma of traditional pantry line, increased demand due to rising living cost. And also it has the input, the activity, and the output. And for the outcome, our short-term goal was to reduce hunger, increase calorie intake, raise awareness of food access solution. Our intermediate term outcome was to boost consumption of fruits and vegetables, improve knowledge of healthy eating, and our long-term goal was to reduce food insecurity, lower rates among low-income residents. Next slide.
Okay, our evaluation questions are, we have three. The first question looks at the activity of sorting food. We ask, did the food sorting process comply with the proper measure to ensure quality standards of food and items distributed? This question is important because sorting food correctly ensures that families receive fresh, safe, and appropriate items every time. To answer this, we're using every time. The second question focuses on the output, how food is distributed. To what extent did the weekly food box distribution process adhere to the pantry's rules for providing quality service? The third question addresses our long-term outcome. How has the program affected food insecurity among program participants? Next slide, please. How we plan to answer the evaluation questions effectively. We're using a combination of structured observation, administrative data, validated surveys, supported by qualitative interviews. This blend approach helps us gather both measurable outcomes and reach context behind those outcomes. For the first question, which looks at food sorting practices, we'll use weekly observation checklists completed by pantry staff and trained volunteers. These checklists help ensure the sorting of canned goods, produce, dairy, and bakery items is consistent and up to standard. Occasional peer audits will provide extra layer of quality control and making sure that process aligns with Minnie's internal protocols. At the next question, we're evaluating the quality of the weekly food boxes distribution process. We'll analyze administrative tracking records that already exist within the pantry system. This includes data on how many boxes were distributed, the time of distribution, and whether they were prepared as planned. These records help us determine how closely the pantry's practices follow the intended service model while keeping the workload realistic for the staff. Our final question, we're assessing whether the program has made a long-term impact on food insecurity. We'll use USDA's 6-item food security model, a validated tool widely used in public health evaluation. Surveys will be collected every 6 months over 2 years. Additionally, we'll conduct short interviews with a sample of clients at the 12 and the 24-month point to capture their lived experiences and add depth to the survey data. This combination, sorry, my thing is sticking. This combination of methods ensures our evaluation is grounded in evidence, responsive to stakeholders' needs, and realistic given the resources at hand. Why are we choosing these approaches? That's the best methods for assessing routine activities. Overall, capture rich longitudinal data on food security. We choose these evaluation design because it allows us to assess each part of the program using the most appropriate and practical method, especially important for volunteer-led organizations like Minnie Food Pantry. First, for the food sorting and distribution activities, we'll be using a post-test only design, also known as Design 7. This is considered the best option for evaluating routine processes when there is no need to measure before and after, but rather assess how well the process was carried. It gives us a clear insight into quality without placing extra burden on staff or clients. Next, our long-term outcome about reducing food insecurity. We're using a time series design. This allows us to collect data at multiple points over 2 years, showing not just whether change occurs, but when and how. This approach is especially useful when working with complex outcomes like household food insecurity, which evolves over time. Finally, the mixed method design works well because it balances the need for strong evidence with the realities of our setting. It uses tools that are validated, like the USDA 6-item food security model, and adds client interviews to give us the real stories behind the numbers. More importantly, it allows us to deliver meaningful insights to stakeholders without overwhelming the people or systems doing the work. Next slide, please. Our evaluation for Minnie's Food Pantry drive-thru service used a mixed method time series design, meaning we're collecting both quantitative and qualitative. So the quantitative will be based upon numbers, and the qualitative will be a story-based data across multiple time points over 2 years. This design allows us to not only assess whether the program is working, but also how, for whom, and why. Here's how we structured it. Quantitative data, what we measure with numbers. We'll use a structured checklist each week to evaluate whether food items such as canned goods, produce, and meat are sorted correctly. Peer audits will be conducted periodically to ensure consistency and adherence to pantry quality standards. In regards to the food box distribution, we'll review weekly administrative records to track the number of food boxes distributed and compare this to the number of clients served. This helps us evaluate whether the distribution is consistent and aligns with community needs. Finally, food insecurity. To assess long-term impact, we'll use the USDA 6-item food insecurity model at five time points, baseline, and then every 6 months through month 24. This validated tool helps us to track changes in household access over time. Qualitative data, what we learned from the conversations, at 12 to 24 month marks, we'll conduct short, semi-structured interviews with small groups of clients. These conversations gives us deeper insight into the lived experiences, what works, what's still hard, and how the program impacted them personally. This kind of feedback helps us explain patterns we see in the numbers and find areas of improvement. Next slide, please. Why we choose these designs. We selected this particular evaluation design for Minnie's Food Pantry drive-thru service. Our evaluation uses mixed methods, which blends qualitative data, like numbers of food boxes changes in food security, with qualitative data from client interviews. This combination helps us not only what is happening, but why it's happening and how clients experience the program. For our processed food questions, like how well food is sorted and distributed, we're using a post-test design, also known as Design 7. In CDC's framework, this is considered appropriate for quality-based evaluation when pre-testing is unnecessary and impractical. For our outcome food question on food insecurity, we're using time series design, collecting survey data every 6 months for 2 years. This repeated measure approach lets us track real changes over time, which is especially important for assessing longer-term outcomes. We've made sure that our evaluation methods are realistic and sustainable for a nonprofit pantry led primarily by volunteers. The tools we're using, such as structured checklists, administrative records, and validated survey, require minimal staffing training and are low burden to clients and staff, yet still deliver credible, actionable results. By combining these elements, our design proves both rigor and relevance. It supports continuous program importance while ensuring that the voice of the people served are heard and valued. In each phase, this slide outlines the 5 phases of our evaluation timeline designed to spend 2 full years to allow meaningful data collection and analysis. Month 1 will be the baseline. We'll begin with an intake survey using the USDA 6 food security model to measure baseline food security. At the same time, we'll initiate food box tracking using administrative records and begin observational tracking for food sorting quality. Month 6, which is checkpoint 1, we'll follow up with another USDA survey, continue collecting weekly distribution data, and maintain sorting logs and peer audits to assess sorting quality, distribution consistency. Checkpoint 2 will be month 12. This midpoint includes another survey and our first round of short, semi-structured interviews with clients. These help us understand our participants perceive the program's impact on their food access and identify areas for improvement. Month 18 will be checkpoint 3. We'll continue administrative data collection, observing sorting compliance, distribution surveys. This phase helps track consistency and quality in ongoing service delivery. Our final checkpoint is month 24. It's going to include a survey, includes a survey, client interviews, and a full analysis to assess long-term trends and program effectiveness. By this point, we'll have collected rich qualitative and quantitative data to answer all 3 evaluation questions. This approach allows us to align each method to its respective questions using appropriate timing, post-test only methods for activity and output, and time series for long-term outcome. Using validated tools and simple tracking mechanisms keeps the evaluation feasible for volunteer-based organizations like Minnie. Next slide, please.
Hi, my name is Marie, and I'm going to discuss data collection plan. To assess Minnie's food pantry drive-thru program in Plano, Texas regarding food sorting, weekly distribution compliance, and impact on food insecurity, we propose collecting specific operational and impact data using mixed method and presenting findings. So food sorting quality data, records of inspected food items, including removal of unfit and out of condition products, types of quantities or of perishable versus non-perishable items distributed. And then there's a weekly food box distribution compliance data, which is the number of food boxes distributed against scheduled operations, which is Wednesday to Saturday from 8:30 in the morning to 11:30 a.m. Adherence to client load rules, example, trunk loading procedures or handed procedure, no walkthrough. And client waiting time and service time, and consistency in quantity and quality of food per box, which ranges from 75 to 150 pound range. Staff and volunteer adherence to established protocols and procedures. And then the next item would be a program impact on food insecurity. So participants' food insecurity status is tracked over time using validated survey like the USDA food security module. Frequency of pantry visits per participant, participants' health and diet quality self-assessments, qualitative data from client survey, or interviews on changes in food access and well-being. Next slide, please. So to continue with data collection methods, so there will be direct observation and inspection, on-site monitoring of food sorting process to ensure the removal of unfit products before distribution, use checklists and quality control logs maintained by staff, record food boxes distributed and client demographics, so how many boxes are given out and who received them, survey and questionnaires, periodic participant survey using standardized food insecurity questions to assess program impact over time. So feedback forms capturing client satisfaction, distribution experience, and food adequacy. Interviews and focus groups. So what we'll do is conduct client and staff interviews for qualitative insight on process effectiveness and product benefits. And the last thing that we're going to do is also routine reporting by staff. So this would be a weekly report on distribution volumes, anomalies, and compliance issues. Next slide, please. So how are we going to present our data to the stakeholders? So we're going to use visual boards, visual dashboards and reports, create clear charts and graphs showing food sorting compliance rates, distribution volumes, and client food security trends. Use before and after comparison to highlight the impact of food insecurity. Incorporate quotes and stories from participants to humanize data and demonstrate meaningful outcomes. Regular performance summaries, so that is to provide concise monthly or quarterly reports summarizing key metrics, challenges, and improvements. Interactive presentation, so the use of customizable and editable PowerPoint presentation to showcase operational efficiency and impact to funders, donors, and policymakers. And lastly, we're going to use annual impact reports, compile comprehensive impact reporting combining quantitative data and qualitative feedback to strengthen transparency and inspire continued support. Next slide, please.
In conclusion, our evaluation plan for Manny's Food Pantry Drive-thru was designated to assess how effectively the program is addressing food insecurity among residents in Plano, Texas. Specifically, we selected three key elements for evaluation: activity, the sorting and distribution of food boxes, number of food boxes distributed, which is outcome, and then the long-term outcome, which is the program impact on reducing household food insecurity over time. To evaluate these components, we are using a mixed method approach combining quantitative surveys and qualitative interviews. This strategy provides both measurable outcomes and a deeper understanding of client experiences. Our data collection methods include intake and follow-up client surveys based on the USDA six-item food security module, administrative tracking of food boxes distribution numbers, and client demographics, semi-structured client interviews to gather personal narratives about food access. And the next step is our evaluation process, which include finalized survey instruments and interview guides with stakeholder feedback, launching pilot testing to ensure reliability and validity of our tools, conducting baseline data collection during the initial months of implementation, continuing data collection checkpoints at 6, 12, 18, and 24 months. And finally, this evaluation matters deeply to the community of Plano, Texas. While often considered an affluent area, still experiences significant disparities in food security, particularly among low-income and minority households. By rigorously evaluating the drive-thru service, we can ensure that resources are reaching those most in need and make evidence-based improvements. Evaluations like our like ours contribute to public health by promoting program accountability, equity, and sustainability. Moreover, empower local communities through data-driven improvement, uh, aligning with broader public health goals of reducing health disparities and improving quality of life. Thank you for attending our presentation. And our next slide is our reference. That came to the end of our slide.